Hello everybody. Today I'm going to talk a little bit about culturally appropriate care in long-term care facilities. And I'd like to start with a story that I have. So when I first started working with seniors, I was given the responsibility to create a weekly seniors program in a local community for Chinese immigrant seniors. And at that time, I was really excited about the new job. I was fresh out of university, full of hopes and dreams, and I was ready to tackle my first task. So I created this lovely schedule with different kinds of activities that I have for the seniors every single week. And I figured it might be a good idea to talk to the seniors and get their feedback. And as you could probably tell, it didn't go so well. So they basically shredded my hopes and dreams and my ideas into pieces. And the message that I received from people is that I was too young to understand what seniors are going through, their likes and dislikes, and basically I wasn't fit for the job. So that's really comforting, and you can understand how, you can imagine how devastated I feel at that time. But I managed to pull through. And over the years that I've worked in the senior sector, I've come across people once in a while that would question my expertise and my knowledge in seniors care. And at that time, I feel very misunderstood and sad because this is not who I am as a person. But over time, I've learned to brush it off more easily because I know that if I was being able to give the opportunity to connect with these people on a personal level, and making a connection with them and allowing them to know who I am as a person and as a staff who's working with seniors, I would be able to gain their trust and their respect. So I guess the moral of my story is that we all make assumptions in our lives. And as a matter of fact, our brain is genetically hardwired to make these mental shortcuts that helps us basically to process the vast number of information that we have processed every single day. While these kind of mental shortcuts are very efficient, but we sometimes inevitably make mistakes as well. And over the years, I've discovered that one of the key strategies that correct these wrong assumptions that we all have is through basic human connection. And and by that I mean the simple human bonds that we all have with one another, the authentic sense of identity and belonging that we all have that makes us happy and gives meanings and purposes to our lives. And in long-term care facilities, a lot of the service providers and residents are put into an environment where there's not a lot of meaningful connections between them. And this is problematic because a lot of this interaction is important for mutual understandings, and without that, there's a lot of misunderstandings between people, and we have incorrect assumptions to each other as well. So I was talking to a lady earlier, and her mom is actually in residential care, and she said that when the nurse is trying to bathe her mom and trying to take her clothes off, and the mother was really agitated and frustrated because they're not used to being manhandled by these nurses. So it creates a lot of frustration in two parties. So I can understand how creating culturally appropriate care is a challenge in long-term care facilities. When we talk about culture, our knee-jerk reaction is that, oh, it's about people's ethnic backgrounds. But as we all know, culture is a lot more than that. And as a matter of fact, every single one of us has a culture. And it is influenced by our upbringings, our education, the places that we lived in, and also our life experiences as well. And culture not only affects the way we perceive health, but it also helps us to understand how, where our diseases come from and how we go about treating them. So when we talk about how to address people's cultural needs, it is very important. So when we talk about addressing people's cultural needs, we often focus on obvious differences like the different languages that we speak, the different clothing style that we have, and also the different kinds of food that we consume every single day. But we rarely think about and take the time to understand people's values, their beliefs, their unique stories, as well as their particular ways of understanding the world. But these kind of silent elements of culture is what's important, and it's actually what's important for addressing people's cultural needs in a meaningful way. So when seniors move from homes to long-term care facilities, they may sometimes feel lost or confused because they are put into an environment where everything is so standardized and there's not a whole lot of opportunity for the seniors to express their identities and be socially engaged. And these kind of situations leads to a number of adverse health outcomes, such as higher rates of depression, slower recovery rates from surgeries, faster development of degenerative diseases, as well as more cases of hospitalizations over time. So although studies have shown that maintaining meaningful social connections can buffer some of the adverse health outcomes of aging, and a healthy social network will help seniors to better adapt to their new lives in long-term care facilities, there are a number of challenges that prevents the residents in long-term care facilities from getting the kind of culturally appropriate, person-centered care that they deserve. First of all, as many of the previous speakers said, many of the long-term care facilities do not have the adequate staffing level that we all hope to have. And this means that a lot of the service providers are usually very busy running around trying to meet people's medical needs. And when they're not with the residents, they are usually trying to deal with the increasing amount of paperwork that they have to do. So writing reports and getting information for the reports. And situations like this rule out any opportunity to have a meaningful, normal conversation with the residents, and let alone trying to get to know the person and know their identities and needs. And furthermore, many staff members in long-term care facilities do not speak the languages that the residents speak. And a lot of the translation burdens are given to volunteers and family members. So that makes making a meaningful conversations with the residents a lot more difficult. Our healthcare system is designed to based on the principles of efficiency and cost effectiveness. But as we all know, health is more than just the absence of disease. And while we are striking really hard to make our healthcare system more and more like an assembly line, we sometimes forget the very essences of a basic human life. And by that, I mean being able to connect with one another in a meaningful way, having a sense of belonging, having the freedom to express ourselves and our identities. So if healthcare services can emphasize more on fostering social connections and facilitating those mutual understandings between service providers and residents, I believe seniors are more likely to age with dignity and respect. That's all I have.